By a show of hands, how many of y'all out there have a Black primary care physician? That's right. Put the little hand up in the chat if you have a Black primary care physician. Well, if you do, good. If you don't, maybe you should consider getting one. But either way, it's going to be hard to have one soon because anti-DEI laws are making it hard for medical schools to recruit and to retain doctors of color, specifically Black doctors, Hispanic doctors, and Native American doctors. Students from those groups are vastly underrepresented in the medical field, and the underrepresentation of Black folk and brown folk and indigenous folk, it leads to more severe, more intense health disparities. See, this is, again, no small thing. And I know sometimes we talk about this stuff like a small thing, but in 2023, it was huge when the Supreme Court demolished another long-standing precedent. I'm talking about decades of progress as well, when it struck down affirmative action on college admissions decisions. The conservative majority of the Supreme Court, mostly white, of course, declared that race could not be a factor. It forced public colleges and private colleges, public universities and private universities to find other ways of creating a diverse student body. Now, once the Supreme Court issued that ruling, laws restricting or banning DEI and DEI programs popped up in more than 24 states, more than 24. The Supreme Court's ruling against affirmative action is hurting efforts in Mississippi, for example, to recruit more doctors. More than 1 million people in Mississippi are Black. And you know, there are only 600 Black doctors? That's stunning to me. One study found that life expectancy was longer for Black patients who had access to Black doctors or Black primary care physicians. So some of y'all are like, all right, how do you thread this needle? How do you square these circles, Mark? How do you get from DEI to Black people dying at birth? Well, let me be clear. Black people are perpetually harmed by the medical establishment for decades, no, for centuries. We have been told that we're crazy. We've been told that we're physically built poorly, that we're cognitively built poorly. We've been told that we have higher, or at least been treated like we have higher pain thresholds. We are denied, pain medicine because people assume that we're drug addicts. And I mean, like, there's so many things that happen to us in general. Now, how do you address the fact that Black folk get treated so poorly in the hospital and in primary care situations? Actually, before I even tell you that, let's think about why it matters. It's not just that you have a bad experience. This isn't just like having a bad waiter. When you get bad healthcare treatment, when you get treated poorly by the doctor, when their bedside manner is awful, when there's racism and white supremacy undergirding the interaction, that means they don't hear us when we say we're hurting. That means they don't listen to us when we say that we have a condition or potentially have a condition. That means that they think we can bear more than we can. Those are the reasons partially why Black women die more at birth. And Black boys and girls die more at birth. And Black women die more giving birth. Now, how do you fix that? Well, part of how you fix that is by having more Black and brown doctors. Now, white people should treat us differently. White doctors should treat us the same as they treat all their patients. And there's a way that we have to work on that. And there's a way that culturally responsive, culturally specific, culturally centered continuing education should happen for doctors, so that white people are also held responsible for white supremacy, not just Black folk trying to be the healers of the world. But at the same time, another way to do it is to actually bring Black doctors into communities. People who know the illnesses, they know the culture, they know the language, they know the challenges, and they view them as human beings. That's what you want. That's been the plan. That's why we keep trying to bring more Black doctors along. That's why we try to create bridge programs and mentoring programs and all these things to create more Black doctors until the DEI police came out. Because now that the DEI police came out, everything is different. In 2023, the Supreme Court demolished another longstanding precedent and decades of progress when it struck down affirmative action in college admissions. As I said before, this is a problem. So if you strike down college admissions and you say, look, we're not going to be intentional or specific about producing or recruiting Black doctors, then you're going to have fewer Black doctors. Not because there was some lowered standard for Black doctors or Black medical school admissions. That's a lie. But because when you're intentional about recruiting Black people, you say, I want you on my campus. And then when they get on that campus, they have access to the networks and the supports and all the things that people have in these fancy universities. So being intentional about recruiting Black people or brown people or indigenous people is necessary. But we're not doing that anymore. We were unofficially kicking them out and unofficially making their lives difficult. But now with these new DEI laws, you can justify putting them out or ignoring them or not being race or cultural specific. This is the problem. This is the problem. And so now we have a pipeline that is fractured. So if you go to a place like Mississippi, where there are 1 million Black people and literally 600 doctors, 600 Black doctors, and you know that Black doctors make you live longer if you're Black, you gotta ask yourself, why don't we just get more Black doctors? Why don't we just recruit more? Why don't we just be intentional about it? Well, this whole Supreme Court movement is to not be intentional about it, not because they believe that there's some real racism happening in DEI, not because they believe that recruiting Black doctors is an issue at the ethical or moral level. It's because they want their kids in those schools. They want their kid in the fancy business school. They want their kid to scrub in as an intern at some hospital associated with Harvard or Penn or whatever. This is what they want for themselves, and they don't want to be competing with Negroes who they believe don't belong. So the anti-DEI laws are about the collection of wealth, the accumulation and hoarding of wealth and opportunity by the 1%. It's also about white people policing race and policing the kind of conversations we can have about it. But the consequence isn't just ideological. It's not just that now all of a sudden we can't talk about race, or now all of a sudden there are fewer Black people. It means that we are not creating and strengthening and maintaining, sustaining the pipelines that get people into the medical field. And because those pipelines are being dismantled, we now will have even fewer doctors. If you have even fewer Black doctors, you have even fewer connections and even fewer supports and even fewer mitigators. And when all that happens, more people die. So I'm sure the right will skewer me for this for saying this, but yeah, when you cut DEI, you kill Black people. When you cut DEI programs or anything or something like them, you make life less livable for the most vulnerable people in the world. Just something to think about.